Hello, my name is Roupen Djinbachian. I am an internal medicine resident at the Montreal University Hospital Center, and it is with great pleasure that I present to you today our article entitled Optical Diagnosis of Colorectal Polyps, a randomized control trial comparing endoscopic image enhancing modalities. Screening and surveillance programs have been put in place to reduce the morbidity and mortality associated with colorectal cancer. During these procedures, polyps are resected and sent for histopathology diagnosis, which can be costly and associated with significant delays. Recently, there has been increased interest in using optical diagnosis instead of histopathology to reduce the costs associated with histopathology. Methods such as resect and discard or diagnose and leave strategies have been proposed as an alternative to pathology-based diagnosis. However, implementation of these strategies has been low, as endoscopists have cited the fear of making incorrect diagnoses as the main barrier to implementation of these strategies. The American Society for Gastrointestinal Endoscopy has proposed several thresholds for quality assurance of the implementation of diagnose and leave and resect and discard strategies, namely the achievement of 90% adherence to pathology-based surveillance interval assignment and a 90% negative predictive value for rectosigmoid adenoma diagnosis. Providing endoscopists with tools to make diagnoses more comfortably has been the main factor which led us to conduct our study. We conducted a randomized control trial comparing iScan and Optivista image enhancing endoscopy. iScan is a digital image enhancing technology that allows for higher detail evaluation of mucosal structures during endoscopy. In comparison, Optivista enhanced endoscopy introduces an optical filter pre-processing to allow for increased contrast for evaluation of vasculature and mucosal patterns. The aim of our study was the percentage adherence to recommended surveillance intervals compared with pathology for optical diagnosis of iScan or Optivista. And our secondary outcome was rectosigmoid negative predictive value for the diagnosis of adenomas. We found that iScan and Optivista both surpassed the 90% quality threshold benchmark provided by the ASCII. However, only Optivista surpassed the 90% negative predictive value for the diagnosis of adenomas in the rectosigmoid. In conclusion, both iScan and Optivista are similar image-enhancing modalities that can both be used with confidence for the diagnosis of polyps in the colon. However, only Optivista achieved the thresholds required for the implementation of diagnose and leave strategies in the rectosigmoid. Future studies should look into both of these image-enhanced modalities in multi-center trials, and more studies need to be conducted to provide endoscopists with the tools to make optical diagnoses with confidence in the colon to allow for replacement of histopathology and the implementation of resect and discard and diagnose and leave strategies in the colon. Thank you.